Hi everyone, in today's presentation we are going to be talking about a serious but treatable digestive condition in cats which is called intussusception. We'll walk through what it is, how it's diagnosed, how it's treated, and how you can help prevent it in your cat. So intussusception is a pathologic condition where one part of the intestine slides into an adjacent section, kind of like a telescope collapsing. So this often happens in the small intestine, which is part of the cat's monogastric, which is a single-chambered stomach, digestive system. So it blocks food and blood flow, and if untreated, it can lead to tissue death and infection in the visceral organs. And this is kind of a picture of what intussusception would look like. Intussusception is usually caused by inflammation in the intestines, such as from enteritis or gastroenteritis, which is also common in kittens with worms and infections. It can also follow abdominal surgery or sudden changes in food, like if you change their diet. Young cats, especially those that are undernourished or anorexic, are more prone to this. So you might notice that your cat is vomiting, refusing to eat, or seeming tired and in pain. Bloody stools and straining to defecate are also red flags. So sometimes you may feel a firm mass in the caudal abdomen, which is where the intestines are kind of bunched up. So these are just symptoms to watch for, and could mean that your cat potentially has intussusception. Your vet may feel the cat's belly when you take it in and notice a firm lump. They'll likely take x-rays or an ultrasound to confirm the diagnosis. If there's a lot of abdominal fluid, they might perform abdominal centesis, which draws fluid out for testing. In some cases, they do use a small camera, which is called a laparoscopy, to look inside. So they'll be checking for signs of peritonitis, which is infection in the abdominal cavity, and blocked blood flow in the mesentery, which is the tissue that is holding the intestines in place. And this is what an ultrasound would look like as well of a cat. So surgery is usually required to fix the twisted intestine. Sometimes they can unfold it, but if part of the intestine has died, it must be removed. So after surgery, your cat will get IV fluids, antiemetics to stop vomiting, and possibly antibiotics. Just depends on the cat and what happened during the procedure. Medications may be given by mouth, through a nasogastric or orogastric tube, or via injection depending on their condition. Preventing this condition starts with good parasite control, especially in kittens, so always transition diets gradually. Watch out for loose stool, which is diarrhea, vomiting, or loss of appetite. If something feels off, early vet care is critical. Conditions like hypoproteinemia, hepatopathy, or even pancreatitis can worsen the risk. So regular checkups help catch the problems early. And these are my references and my photo credits. Thank you.